Maybe this makes more of a dramatic entrance. I'm starting up the camera myself, and I've got a little screen. I can sort of see myself there. So this is just going to be a brief one. I have to start up my timer here. I got a letter from a woman who said every night when she went to bed, she had to take her pain medicine and benzodiazepine that she uses for sleep and control of spasms. And she said every night when she went to bed, she was afraid she was going to wake up dead in the morning. People are taught to believe that opiate pain medicines are dangerous and they're likely to die. That came through on a CDC webpage that up in the corner it says how many people are dying every day from opioids. What kind of opioids? Are these opioids from doctors? No. These are opioids in the addiction community. 95% of all deaths in the addiction community are multiple drug overdoses, usually with an opiate, as one of the 5. So you got to be careful, because the CDC is tricking people into believing that when you get a prescription from your doctor, you're likely to die. Not true. Although this is used to send doctors to prison, if your patient that you're giving pain medicines to dies, they assume you've killed them. But if the patient is taking antidepressants or Humira or antibiotics or tricky cardiac medicines, no, they just died with the medications. So you see the opioid hysteria or narcophobia on the part of the CDC, on the part of their advisors, the Physicians for Responsible Opioid Prescribing, and the DEA, who adopted the CDC guidelines and basically is the enforcer for the CDC guidelines. Those 3, or a trifecta, are the only people who believe people in pain should not get opioid pain medicines. That's bizarre. And we will show from time to time in this series and the papers that it is scientifically not true. They're just saying it. So here's the trick. Opioid-related deaths. That means one of the 5 drugs is an opiate pain medicine. Guess what heroin is? Heroin is diamorphine, which is an opiate pain medicine used around the world, but not used in the United States, because in 1924 the federal government made it illegal for all uses, primarily medical uses, in hopes of curing heroin addiction. Nothing's happened in 100 years, and it remains a drug we cannot use as doctors for our patients. In England, they use it in children, babies, pregnant ladies, all because it is a great drug. It was originally developed from morphine in order to have less side effects. It's not bitter like morphine, so you can use it in children. We don't really have anything in children that's not unpleasant. It's extremely bitter. I tried some one day, a little dab. Uh-oh, here come the DEA. Probably arrest me. So the point is, I'm going on and on here. Do not be afraid if you are taking opiates. You're not going to die. Now, what about high-dose opiates? Okay, now here you got to think a minute. If I put 1,000 milligrams of morphine in my mouth and swallow it, how much ends up in my bloodstream? Depends on me and my biochemistry. So it's not the amount of milligrams that you're taking, it's how much ends up in your bloodstream. So there really is no such thing as high-dose opiates. It would only be high-dose opiates if it elevated your blood level. And you can measure blood levels and find out. So there's a lot of hysteria about high dose because this is what sophomoric thinkers come up with. Oh, since all other drugs, high doses are bad, like if you take a high dose of antidepressants, that's not good. That really can kill you. So don't be afraid. Now, about the benzodiazepine and the opiate together, this has become a real hula hoop rage. People are running around saying, oh, you got to taper off one, you can't take the other one. Where's this information coming from? I don't know. It's like the hula hoop. I mean, I remember when I was a kid who played marbles, you know, where did the rules come from? They're just kind of passed down word of mouth. So this is also being part of the trifecta. The DEA is now accusing doctors of prescribing dangerous combinations. Can you imagine that? The law they're working under is drug trafficking. So if I prescribe dangerous combinations in the eyes of the federal drug police, I can be arrested. We're going to talk about the federal drug police elsewhere, but we're talking about not worrying about taking these medicines. So the article that really kind of kicked things off was, let's see if I can find it here in my folder. Ah, yes. This is an article by a guy named Naruban Dasgupta. He is a PhD and not a physician. And he published a study under the auspices of the CDC injury branch. Now, the injury branch run by Deborah Horry is the branch that published the CDC guidelines. So they have 7 or 8 of these centers around the country, and they're funded very heavily every year. These are real plums for universities to get a continually funded, what's going on out there? It's making the background weird. Anyway, there's nothing better than these funded injury centers. So Dr. Gupta, PhD, is part of the one at the University of North Carolina. So he publishes a study that shows that very few people in North Carolina actually die from overdose deaths, much lower than is projected by the CDC, who considers heroin an opioid. You know, remember, opioids are pain medicines and heroin. Tricky, huh? Anyway, he said that 9 times more people died when they had both a benzodiazepine and a pain medicine, opiate pain medicine. But then there's no data. There's no data. You can't make a statement like that with no data. You can't say that 10 times more people die from the combination without data. You see, big money from the CDC. This is dishonest. Researchers don't draw disastrous conclusions without backing it up with data. This man should be fired. But he's written up as a savior and wonderful thing for pain patients, and maybe he is. But this is inexcusable, and he should publish a retraction, because this article gets repeated time and time and time again, 317 times, to foster the attack on pain patients by making them unable to take both a benzodiazepine and a pain medicine, which is a wonderful combination. The spasms from a long-term painful disease were highlighted by Lady Gaga. Her real name is something else. She has fibromyalgia, remember from our talk, that's central pain syndrome or neuroinflammation, a serious problem. She would scream, and on her videos, she lays there on a table screaming in pain. One could be relieved in 2 minutes with Valium, a benzodiazepine that's built for stopping muscle spasm. Now the muscle spasm is coming from, at least we are theorizing, from the inflamed hypothalamus, which is in charge of sympathetic nerves, which then go into the muscles. How do we know that? That was the topic of my dissertation for my PhD. Nerve fibers from the sympathetic nervous system that control blood pressure and pulse also go into regular muscle. So when they're charged up, your muscles become painful. That's the myalgia of the old fibromyalgia, pain in the muscles. And they are beautifully relieved with benzodiazepines. So we're depriving people like Lady Gaga, who couldn't go on tour because she was in so much discomfort. We're depriving them of a wonderful, safe drug because of people like Mr.